This is Jerry Hesch, a physical therapist who is also an orthopedic manual therapist, meaning that I treat joints. And I work at Hesch Institute in Aurora, Colorado, and I also teach courses on the sacroiliac joint and have developed many aspects of the evaluation and treatment of sacroiliac joint dysfunction. And this presentation is on passive motion testing of the sacrum. And the sacrum can move multiple ways between the ilia, and the sacrum can move forward and get stuck at end range, and the way to test that would be to do a passive thrust called a spring test on the top of the sacrum, and you would find that it could move further, but you would find that when you spring the bottom of the sacrum that it did not move. The sacrum can rotate left and right, and that test is done by springing the upper part of the sacrum on each side. The sacrum can side bend left and right, and that test is done at the bottom of the sacrum, pushing upward on each side. The sacrum can also get stuck posteriorly, particularly when someone delivers a very large baby that pushes it backwards, or when someone falls on the buttocks. That can cause the sacrum to get stuck posteriorly. And all of those spring tests would be stuck, as would be a midline spring test, testing anterior mobility. In looking for sacral torsions, which are a twist with a side bending component, you can have 4 different types of sacral torsions. And what you do is divide the sacrum into 4 quadrants, drawing a line up and down through the midline and a line across the PSISs, and you would spring test, testing passive motion on the upper right quadrant, upper left quadrant, right lower quadrant, and left lower quadrant. And doing these specific mobility tests are important in coming up with a movement diagnosis. Is there a direction in which it is hypomobile, in which we need to restore movement? And that's the purpose of this testing. And you will also have directions where motion is increased. But by restoring motion in the direction where it's lost, that will reduce the hypermobility because it brings the sacrum back into a balanced position where the ligamentous forces are much more balanced, able to heal, and same for the muscles. And there's one last movement that one can test with the sacrum, and that is inferior glide motion. And that's more of a testing of the facet joints where the L5, the last lumbar facets, join with the upper sacral facets. And again, that is inferior glide mobility testing. And that completes my presentation.